So now comes the main topic, that what during lockdown, what dentists can do during lockdown, which is the most important question everybody is seeking for the answers. So the answer is very simple, that if you are having the old practice, or if you are a newcomer, so the things are very common for both of you. The first thing for sure that one should do right now, if not done yet, is that you have to greet your patients with a very polite message and just a caring message for the patient. This is the sample which has been shown to you in the presentation. If you are using any online practice software management like Practo or Liberate or any other practice management software, so there is always a SMS column given there. So in a single shot, you can provide this SMS to all your patients in your database. Or if you are not having the practice management software, if you are having the manual, so I will suggest to go with the WhatsApp business application and provide all the contact details there, and in a single shot please send this type of beautiful message for the patient from your side, that due to this COVID-19 and due to the emergency, we are only treating the emergency patients, and do tell the categories of the treatment provided, so that nobody get confused that we are open and all the dental procedures are going on. So you have to mention this in your message, and the patient will be happy and he will know that till the doctor is caring. So there is no chance that you will lose your patient. First of all, if any new patient is also calling you that that one dentist is ignoring my treatment, please you do this. So it is also better to convey this message for the same. And also, I will suggest, it's not written here, I will also suggest that please do mention after everything, do mention them, that all the dental protocols after the lockdown will be changed, and the treatment protocols and the pricing will be changed. Don't disclose the pricing right now, because all we have to go for a proper pricing for the patient, so that they don't suffer and we don't lose the patient also, and it will be like a no profit no loss thing at the present scenario. We can't charge high, we can't charge less. We have to do in such a way that the patient don't we don't lose the patient and we don't lose our practice. So we have to do in such a way. So future, in the further slide, I'll be telling you that what we are lacking right now, how will the pricing will be done. I think a new lecture will be done in managing the dentistry, managing the finances in dentistry. So a new lecture will be done on that in a brief detail, that how we have to manage our finances as well as for the clinics. So this was for the lockdown. You just have to give the SMS to the patient, and you have to give them a reminder regarding the dental treatment protocol. You can WhatsApp them. In every mode of communication, you can talk to them. You can do teleconsultation. You can ask for the pics of the photographs of the patient treatment problem, so you can be able to see whether a patient is telling lie or not, whether it's definitely a medical or dental emergency or not. So you will be having a proof with you. And also, I would suggest that please, whether it's a new patient, whether it's an old patient, if your database is not been updated with the address of the patient, so it is recommended to please update your database with their address. If it's a new patient, tell them to SMS or WhatsApp you your current address with full details, with the name, address, and contact number, because it will be required for future if the patient is coming for normal consultation also. So I don't want any dentist to go for the risk that they don't have any database in their this thing consultation in teleconsultation. So the next procedure is what after lockdown gets over. The upcoming slides are both for emergency treatment as well as after lockdown gets over. So you can compare it between the two. So after the lockdown gets over, so definitely we'll be coming with the new dentistry protocols, which will be getting updated day by day. So this is basically, you can take the screenshot of this if you are able to take it. This is the main thing which we have to do during the medical emergency or during after the lockdown gets over. So wherever the patient is coming to your clinic, initial teleconsultation has been done, initial screening has been done, because in India there are 70 to 80% of patients which never disclose proper medical history to you. So they always try to hide some of their medical history, and you are not aware of that. You only get aware when the patient sits on your chair. So it is always suggested to go for a thorough teleconsultation. Please make sure and explain all the things to the patient that during this time you have to disclose every detail. So we don't want to face any risk as a dentist and you as a patient. So the silence, if you feel any silent symptoms are there for COVID, so if it is found to be suspected, so it is better to report to the local and the state health care agencies so that they can take the control of that patient, and you can still video conference or teleconsultation with that patient, and don't do the treatment for the next 2 weeks for the patient. He will be in the isolation, and he can be also in the quarantine mode. So it takes usually 1 week to for the patient to get know that he is not facing any fever or any sign and symptom. After that, he will be going for the test, and if he found to be a negative one, then he can come for the dental procedure. And if the patient is coming for the urgent care, like if he's having the acute pain and swelling, so it is recommended to prescribe him antibiotics and analgesics, and you can do the follow close-up with the telephone and WhatsApp. So it is also suggested, please don't SMS the patient the medicines. If you are using the online practice management software, it is suggested, please SMS the prescription as per the software SMS protocol. Don't do the simple SMS, that won't be counting, and that can hamper your dental practice, because it's a mandatory thing as per the IDA guidelines. So you can WhatsApp, or you can basically use the practice management software. Those who are not using, they can simply WhatsApp as they record and with all the patient details in it. And if it's the emergency care, if the patient is totally negative, so you have to maintain airborne infection isolation room, so where you can conduct this dental treatment. You have to take all the initial screening that I will be showing in the next slide. So before the patient enters to your clinic, I will suggest you to please print out these things as IDA and WHO have told you. Before any patient enters to your clinic, it is suggested to post these posters or make a standee or anything and display it outside your clinic, so anybody can see instructions and do the hand wash and hand rub accordingly. So the hand wash usually take 40 to 60 seconds, for hand washing, and hand rub usually take 20 to 30 seconds. So these posters have to be placed outside also, and it is a good option if you keep the printout inside your clinic also. Similarly, the respiratory and coughing and sneezing etiquettes. So I would suggest, please, this was not told, though I will suggest, please print out this also and keep it outside also and inside your clinic also. So it would be a good thing. The patient will see the images and still follow the protocols. So before a patient walk in, I think it should be now mandatory that all the povidone, 0.2% povidone or 1% hydrogen peroxide mouthwash should be recommended, that the patient should enter only after doing the mouth rinses, after doing the hand wash, and sanitizing his hand and wearing a mask. So these are the basic things before you let any patient walk in your clinic. So the chlorhexidine based mouthwash are not effective now for the effective killing of the COVID-19. So it is suggested to buy these bottles if they are available right now, so that they don't get any out of stock thing. So keep some bottles in your clinic. So whether in emergency or post lockdown, you can use this mouthwash after the hand wash and hand rinses technique, and patient can then with this and use the mask. Also, it is suggested the patient sorry, I forgot to tell you, during the teleconsultation, do mention the patient if he is not geriatric or pediatric, she should come with only one member only. We don't want any crowd. So please mention these things. So the only initial screening device which we having right now for recording and testing the patient is infrared thermometer. So you should before entering, doctor should take the record of the patient by measuring the temperature. If it is more than the body temperature, so I think you should avoid that patient to enter and give the post appointment after a week or two. So it is suggested for that patient to go for the COVID test or be in a quarantine or isolation, so it won't be spread anywhere. So the patient in the waiting area should wear a mask. It should be a 3-ply mask, not a cloth mask or any other stuff, because they are not able to penetrate any virus. So the appointment should be strictly by appointments only, through teleconsultation only. If any emergency patient is coming without any appointment, but I will suggest you to don't take it, because the patient is already in a panic mode, and he will always force you to please treat me, that everything will be in confidential, so I won't be creating any problem. He will be keeping confidential, but for you it will be a very risky part, especially for the doctors who are having clinics in their home and they are not in the commercial market. So I will suggest don't entertain such a type of patient right now. Just be polite with them and just explain that we can write down your antibiotics and painkillers as suggested as per your any chief complaint, but right now we won't be treating you as such. So only one attender per patient, and the patient attender is allowed into the operating room if only the patient is minor. If the patient is a kid or a child, only the parent of a patient is allowed, only after making him wear a PPE, otherwise not. I don't think that it should be attended, but because of the minor, sometimes they cry or they feel panic, so a parent is required. So the whole protocol will be used there also. We have to wear that PPE dress for the patients, and the same procedures have to be followed. So what do you think, that we only have the infrared thermometer right now as an initial screening? The answer is no, because we are also coming with the testing kits. So I will be showing it in the further slides. So that is also a good option, which will be coming very soon in India, because one batch has already been distributed because of the short productivity. Now it has been patented by the government of India. So soon there will be a mass production of that kit, and we all will be cured very soon. We will be properly screened whether we are corona affected, COVID affected or not. So when the patient turns in after getting the temperature done and the patient is fine, patient is asymptomatic, no coughing is there, no fever is there, no respiratory problem is there. So it is suggested to ask the patient to fill this form or you can fill it from your side. This is the self-assistant form for the COVID-19 and for the patient, whether they are COVID affected or not. So you can also take the screenshot of this. These are the few symptoms and the clinical notes. You have to ask the patient that whether they are experiencing these things or not, or whether they have any travel history, if between in the last 14 to 30 days. So you can take these histories. This is the part one of the assessment form. The second one is if they have any travel history. I think internet is going slow. If they are having any travel history, so it is suggested to take their traveling details, and if they are coming from by cars or trains or buses, so you have to take all the details. So flight details, the flight number, and the date of travel and coming, date of arrival. So whether this is the most important question, that they have ever been in contact with a corona positive case in the family member or relative or not. So these things have to be mentioned. Apart from this, one question needs to be asked that whether they are having any medical illness like asthma or COPD, anything else. That has to be asked. So this was the answer, that apart from infrared thermometer, we have one more screening which will be soon provided in Chandigarh also, because right now, as per the information, this kit, I was asking about this kit, this PPE kit has now made in India. Now it has been patented by the government of India. So soon the production of this kit will be in masses, so that we will cover all the people in a very less period of time, and get ourselves tested whether we are positive or negative. So this kit will be available very shortly. I think within a month period, it should be here in Chandigarh also, and in all the different part of the country. So the labs which are having the PCR machine, they will be able to do this test, and we will be getting the report as soon as possible within 2.5 hours to 5 hours. Between 2.5 hours to 5 hours, we'll be getting the report of the patient, and it is cheaper as comparison to all the PP kits which we were getting from USA or China. They were costing very high, so it is 4 times more lesser the price and more effective than the kits we were importing from the outside. The benefit of this, because we were previously India were doing the antibody, they were importing the antibody test kits, but the reports which were coming were very late. It was usually taking 5 to 7 days to get that report, and also costing around 4,500 to 7,500 for getting that COVID test done. But recently, this test kit has has been delivered here. The one batch has been delivered here in PGI and also in ICMR and NIPER. So they are getting very good results. It's hardly 2.5 or to 3 hour job, and they are getting accurate results. That whether the patient is positive or negative, they are getting the accurate results. So this kit will be provided. The test will be provided by 1200, only 1200 to 1400 rupees. So I hope soon, sir, that this kit comes to us and we get two types of screening, like infrared thermometer screening also, and this will definitely help us out whether we can treat the dental patient or not. So the patient can come into your clinic, we can provide the kit, we can provide the address of the lab. So soon the patient will go to the lab and go for the test, and within 5 hours the doctor will be sent the report, and the patient can be reverted back to the clinic and go for the treatment. If the patient has turned out to be positive, same procedures have to be followed, that isolation has to be done, and patient should be in quarantine. After that, after filling the self-assessment form, now comes the COVID consent form. Now every clinic should make the consent form as per their requirement. So this is basically I have made for my clinic, the where you have to mention all the things to the patient, uh, like what are the cons of doing the treatment right now, what are the scenarios we are having right now. So we will be only doing your medical emergency treatment in that environment created right now. So we won't entertain any other treatments regarding any medical emergency. So this consent form has to be signed by the patient, and I can little bit speak about this consent form, so you get idea that how a consent form should be like. So the patient details have to be filled, and you have to ask the patient that I understand that coronavirus causes the disease known as COVID-19, and I understand the novel coronavirus has a long incubation period during which carriers of the virus may not show symptoms and should still be contagious. I understand the dental procedure create water spray, which is one way that the novel coronavirus can spread. The ultra fine nature of the spray can linger in the air for minutes to sometime hours, which can transmit the novel coronavirus. I understand that due to the frequency of visits of dental patients, the characteristic of novel coronavirus and the characteristic of the dental procedure, that I have an elevated risk of contracting the novel coronavirus simply by being in a dental office. I have been made aware of the guidelines that under the current pandemic, all the non-emergent dental care is not allowed. Dental visits should be limited to emergency dental treatment, which includes treatment of orofacial trauma, significant infection, prolonged bleeding, pain which cannot be managed by over-the-counter medications, or management of known high-risk malignancy. I confirm I am seeking treatment for a condition that meets these criteria. Signatures of the patient. The consent form continues that I confirm that I am not presenting any of the following symptoms of COVID-19, like fever, cough, sore throat, shortness of breath, difficulty breathing, flu-like symptoms, or runny nose. I confirm that I am not in a high risk category, or I fall into the list of individual quarantined or advised to stay in quarantine, and my dentist and I have discussed the risk and I have agreed to proceed with the treatment. I confirm that I am not currently positive for the novel coronaviruses, and I confirm that I am not waiting for the result of the laboratory test for the novel coronavirus. I verify that I have not traveled to the respective place as per your city from any country outside of India, whether by car, air, bus, or train in the past 14 to 30 days. I understand that any travel from outside of your present city, including travel by car, air, bus, or train, significantly increases my risk of contracting and transmitting the novel coronavirus. I understand that the government of India has asked individuals to maintain the physical and social distancing of at least 1 meter to 2 meters, and it is not possible to maintain this distance and receive dental treatment. I verify that I have not been identified as a contact of someone who has tested positive for novel coronavirus or been asked to self-isolate by the health department, the communicable disease control, or any other government health agency. Signatures of the patient. So the list of dental treatment, I verify that the information that I have provided on this form is truthful and accurate, and knowingly and willingly consent to have the above listed dental emergency treatment completed during the COVID-19 pandemic. Signatures of the patient and your clinic name. Why I spoke such long consent form? Because it is must for every dentist to have this consent form of their particular respective clinic, and it has to be signed before you bring the patient on your chair. So it is suggest all the previous slide which I have shown you in sequence to follow these all protocols in sequence and go for the self-assessment, also the consent form. So now what I suggest for you as a doctor and for your assistant is that your assistant is not that much educated, and it's your right to educate them for all the protocols and the sterilization technique to be followed in the clinic, and how the patient walks in, and what protocols have to be followed when the patient walks out, and how the instrumentation sterilization has to be done. So I will also suggest, please keep the printout. Ask your biomedical waste department to give this biomedical waste chart to be displayed in your clinic as per the medical health guidelines and as per the NABH guidelines. It is recommended to keep this chart label in the working area so that your assistant get aware that which part of the which instrument and which cotton has to be disposed on which color of the bar weight dustbin. So this is the bar weight which you already know. So it is a mandatory thing now to please keep a printout in your clinic. I should make a poster and keep it on a wall. The second, because now we have to wear a PPE, so the red color is now coming in two types of different dustbin. So how to properly segregate the dental waste? The medical waste has to have a separate red dustbin. It should be a longer dustbin. So it should be a longer dustbin, in which we will be disposing all the blood stained PP dresses and the bandages and all the blood saturated items. This is for the medical dustbin, and all the sharp instruments which we are already throwing in the which red color of bag. So the pharmaceuticals we also suggest to have a pharmaceuticals bag so that we can dispose all the the old patients are also coming, so we can dispose all the medical waste and all the tablets wrappers in that box. So I suggest to have these both type of printouts in your clinic. You can search them on Google, so you will get all the data what need to be printed and posted in your clinic. So what after now we have patient, we have consent form, we have all the self-assessment form. What is the next step is the doctor before we allow the patient to enter the operatory room, so the patient will be sitting in a waiting room. It should not be crowded waiting room. Sorry, I haven't made the presentation of that thing. As you have already attended all the webinars previously, so you have came to know that we have to make a lot of space. So there should be no crowding of materials should be there. So patient should not touch any object there, and you have a chance of the spreading of the COVID virus. So it is suggested not to place any TV remotes in the waiting area, not to place any magazines or newspapers or any pamphlets or even the water dispenser or even a glass cup in the waiting room. And those who are having the closed-based sofa set, so it is suggested to remove that sofa from your clinic, and that can be used at your home or somewhere else, but not in your clinic operatory area. So the sofas have to be replaced by the plastic chairs or the normal steel chairs, so that a patient can can sit there and wait in the waiting lounge. And there should be only 1 to 2 chairs, not more than that, because we have to keep an interval of half an hour to 1 hour between each and every patient, so that the average turns out to be 5 to 6 patients in a day. That is more than enough. If there is consultation, we can, I think it's more than enough. Right now, only 6 patients, if you are doing a day, it's more than enough. So these are the protocols. Now, the doctor and as well as the assistant has to wear the PPE set. So what are the list of the PPE kit, what it contains? It contains the complete PPE kit, in which there is a N95 respirator, and 3-ply mask with a nose clip, the coverall, the surgeon gown which is reinforced, the disposable gown, the plastic aprons, goggles, face shield, headgear, shoe cover, that should be long. So a person who is a taller person like me should be also able to wear that shoe cover. And also the surgical cap, which is disposable. Also the hood cap. Please, the coming slides are very interesting. You will be also very happy to know, and also some shocking type of presentations are also coming. So please be alert and please listen it carefully. So these are the type of PPE kit which is recommended that we should have in our clinic. So the PPE kit, as for the dental, we are talking for the dental. So the medium kit, which is shown here, it is of 70 GSM, but now the government has changed the guidelines that the dentist should wear the PPE kit, which should be at least 90 GSM. So the advanced GSM 180 GSM advanced kit is for the ICU doctors, not for the dentist. So I suggest a dentist not to go for this advanced kit, because I've seen a lot of dentists wearing this 180 GSM, because it will be very difficult for them to wear it for longer hours. So I suggest not to wear that, and go for the medium kit, which should have minimum of 90 GSM quality. So what we suggest in a PP, I've already mentioned, the lists have been mentioned. If we are right now, we are having shortage in our city regarding the N95 mask. Different models are coming, but they are not actually N95. They have been marked as N95 by our dealers and all the chemists, because they are not fully aware what are the proper N95 mask and the respirator. So they are making the confusion between the people. So lot of doctors and lot of people are wearing a simple mask, that is PPF1 mask, other than the N95 mask. So the both things can be done right now. If you are having any emergency patient or post-COVID, you can wear PP dress with the N95 mask or without N95 mask with the normal face mask. So you can, instead of PP mask, you can wear two quantities of 3-ply mask on your face, followed with the face shield or goggles. You can only wear face shield also. Goggles are not that much recommended, but it is acting as a safety. So you can wear both for your safety. So N95 usage, a lot of messages were spreaded on WhatsApp that how we have to use the N95 mask. So I think the same has not to be repeated to you. Still, I can tell you in short that only we have to, as a dentist, we require 5 set of N95 masks, which have to be labeled by 1, 2, 3, 4, 5, and fifth one will be acting as a reserved mask. So the brown paper bag has to be used. That only that you can use the same mask after 5 days, and for repeatedly the whole 5 masks will be acting for 20 days. So I suggest to dispose all the N95 masks after 20 days and replace it with the new one. As per, if they don't get soiled or if they don't get dirty from inside and soiled. So you can, it is suggested to replace all the 5 N95 masks after 20 days. And some were also suggesting, I was coming with the article, some were suggesting that you can use this N95 mask after autoclaving it in a hot air oven for a temperature of around 75 degrees Celsius. So I suggest don't do that wrong thing, because I don't get any guidelines from the WHO or any other department regarding the same. So the people got confused there. So it won't be getting any sterilized, bacteria, viruses won't get die, and your shelf life of that N95 mask will also reduce if you are doing the same. So it is suggested to dispose them of after 20 days and come with the new set of N95 masks. So these are the mask protection efficiency. So N95 providing the more protection from the virus, bacteria, and the fungus. So you can see the chart we have already seen in the previous webinars. So it is suggested a lot of people nowadays are wearing the cloth mask and the sponge mask. So it is suggested to be away from these people who are nearby you and suggest them not to wear these types of masks because they no longer protect any, give you any protection. So it is better to educate them with the right information. So if surgical mask is giving protection from the from viruses 95%, so I think if you are wearing the two quantities of surgical mask, that would be more sufficient and it will be giving as much as protection like an N95 mask. The only shortcoming is that it is not properly sealed, but ultimately it will protect us from the aerosols. So here come very interesting thing, which I think very less doctors are aware about. So the new type of surgical masks are coming in the market by the name. They are not coming, but it has been research on it. So it comes by name of QFITAC surgical mask. So they are being proven as 99.99% antimicrobial and antiviral properties. So they can inactivate all the 99.99% of viruses within 5 minutes, and they also satisfy the FDA standards for safety, and they are Japan made, so they are waiting for approval for their standard certifications, FDA approval. So they are now cleared as the FDA medical devices class 2. So I think these are the best type of masks. This is the basic mask the actual surgical mask should be like. So no dentist or any other doctor is aware about this thing, that this is basically this is the main surgical mask that has to be used before N95 also. This should be provided to us because nobody is aware. So after getting, I think after we get imported these types of masks, so we should further ban we should discard this type of mask in the coming time because they are not that much of effective, because they are two ply and they are not providing that of, because whenever we dispose there are chances these type of surgical masks will spread more infection. Within that, in this we can see it inactivates 99.99% of the viruses within 5 minutes. So there is no inactivation in these types of masks. So as soon as these come, we should discard these. Now come the PP protocols, how to wear, how to do donning and doffing. So I don't want to get in detail because everybody has gone to the WHO guidelines and have seen the chart. So you can also print the WHO based chart on your clinic. So the assistant and you both can see and get friendly how to don and doff the PP kits. So I've also provided you with the YouTube link. I've taken the screenshot of the donning and doffing method, which was beautifully explained in the video which was presented by the AIMS New Delhi. So you can go with the link and see on YouTube how to don and doff. And also in the doffing, you can see 3 dustbins. So donning and doffing, donning is to be performed only if it is in a designated area. The healthcare worker must be prepared for their shift duty by taking a meal, using a washroom and drinking water prior to entering the donning area. Apart from that, doffing to be performed only in the designated area. Check for any leak or soiling in PP before doffing. That has to be checked by your assistant. So if there is any leakage or any soiling, so we have to disinfect that part. That has to be done by your assistant, not you. So doffing should be, room should have 2 chairs, one is a dirty and a clean chair. You can see all the video, every brief detail has been given in that video. So all the PP must be discarded in a red bin, as I've shown you in that bio-waste chart. So we want a bigger dustbin to dispose of our PP. So a lot of people were saying we are coming with the autoclave PP, whether we have a single use PP. There is no type, there is nothing like a autoclavable PP, because it won't be that much effective in the second wearing. So I don't suggest that you should use the same PP in the patient in the next day, because you will be spreading that to the patient and again making your clinic background hazard. So hand hygiene must be performed after every step. So previously I was telling about these three dustbins. So it is better you have these three type of dustbin in your clinic to be installed in the disposing area. So one should be labeled as the face shield and goggles dustbin. One should be labeled as cover all body suit and N95 mask. So the bigger dustbin you can see at the back on the right side, it is the main dustbin in which the PPE suit has to be disposed along with the N95 mask after 20 days. N95 mask has to be keep safe with us because we are a dentist. These are protocols for the ICU doctors. They have to dispose their N95 mask. And all the other PP items that have to be thrown in the dustbin shown in the picture. That is a pedal-based dustbin that you have to push the pedal and throw your gloves and the head caps and gowns covers in that dustbin. So there is no updating. Now the question arises: the PPE which are coming in the market, which the dealers are providing or any medical facilities are providing, they are coming in the various price categories. Some are giving for 400, some are giving for 500, some are giving for 1000 or 2000. So what is the basic difference between that PP? Why there is a price variation in that PP? So we will come to that topic. So there is no updating of any PP standards by the BIS, by the Bureau of Indian Standards right now. So you can see, apart from the medical department, the local bag manufacturers or the tailors, even everyone, they are making the PP dress, but they don't have any protocol, they don't know about any parameters. They are just mimicking the PPE set which have been delivered by the dealers to us. They are just mimicking, they are taking the samples and mimicking and making the design of that PP. They don't know what type of fabric has to be used and what type of standard has to be used, how the sterilization has to be done, whether it is a sterilized PPE kit or not non-sterilized. So no information has been provided as per by the BIS, because I came to know that a lot of PP kits were imported from China, which turned out to be defective. So now new guidelines have been launched, have been received by us. They are launching the new parameters. They are telling that the existing PPE kits will be, get a modification for the safety which we were lacking. So I will be showing you some slides in the coming slides. You will be shocked by what we are getting right now. So this presentation is especially for all the dentists who are trying to buy the PP kits right now, which are in the market. A lot of dealers are selling them by their brand names, and they are giving in a very lesser price. They are attracting with a lot of posters on Facebook. Please call us and buy the PPA kit that we are giving in this much price. There are chances of high rise and all that stories. Now we are doing the biggest blunder in the PP parameter is this. The pink color PP has not been mentioned anywhere by the government or any guideline that we should make the PP. This all of a sudden I took the photograph from my Facebook account, and previously I was I was smiling because I thought that this was a PP made for the female doctors because they like pink color. But ultimately, when I read the parameters, I came to know that this is not the actual parameter, and they are violating the rules that how actually a PP looks like. So a lot of people are selling these, and you can see that this is the promotional photograph which was posted by the dealer to attract the people and give this PP kit. So I want to suggest you don't go for these PP kits. Only the white and the blue one have been suggested by the Indian government to buy as per now. This is the defective PP, which is the result of what we are getting in a less price. Lesser the price, no quality will be there, and this will what you will be getting. So you can see a doctor who has posted a picture for the awareness of all the doctors that everyone who are buying the PP kits of less than four. Price is also not a matter, but the actual parameter is what matters. What is actual parameter? How a PP kit should be made? These are the results of all the local retailers who are manufacturing these type of PP kits. They don't know the fabric quality has to be used. They don't know how to make it. They don't know what pricing should be there. They don't know any standards and certification required for PP kits. So I suggest to everyone, please be sure and be alert what you are getting in the name of PPA by the dealers. I'm not here to blame anybody. I'm not here to blame any dealers because they are only getting that limited type of information. They are only getting the PP and just selling it. They just know what is a PP. They just know the PP word. They are selling only PP. I contacted 2 3 dealers and asked the parameters whether they are following that parameters or not. They don't. They were not able to answer my questions, and they only tried to skip my question by saying, "Sir, if it is for 600, we will give you for 500." I again asked the same question whether this PP kit is following the certification or not because it is the question of safety for both the patients and the doctor. So I request no need to have any panic right now, no need to buy PP kit right now because all the guidelines have been changed. Everything is getting changed. So please enjoy with your family members, get updated with all the dental news which is going, and wait for the right type of PPE kit to be coming in the market. Because right now we are not getting active for our dental practice, that is for sure. So we should have patience and wait for the right time. Nothing will be going out of stock because the company who are certified by the government of India, which are working from, there are very few companies in India which have full certification and maintaining a proper standard to make a PPE. So we should wait for that dealers and manufacturer to come out in the market and to give that PPE kits with the proper protocols and standardization. So I want to show you something on camera. You can see my image, I think. The PP kits right now, I'm having 2 3 samples with me. The PP kit which we are getting right now in the market, I don't know about other cities, but in Chandigarh, which we are getting are like this. You can see this is a normal printout. The printout may be due to due to lockdown also because all the printing facility is not there. But before selling PP, these type of normal printout has been done and mentioning only the price and only for single use. And you can see uh, what is inside the what is the content in the packet. Similarly, I want to show the other one. There is also only what is inside the PPA kit, how much quantity and what it contains. Okay, and no company name is there, only heading and PPA kit. Now coming for sterilization, some dealers are selling these PP. I don't think that you are fooling yourself by the name of sterile or non-sterile PP kits. You are already doing autoclaves. You know the color coding and you know how a seed pouch gets autoclaved and not. I'm just giving a big example. I'm not blaming any company. This is for your alertness and for the people with whom I will share this video later on. We are doing and how we are fooling ourselves and all the doctors by stop people. So just I want to show. Can you see the blue part? This is a normal pouch. On the other side, you will see the pink mark. This is a single packet. Why is having two different marks if it is properly sterilized? As per the sterilization, good turns out to be pink. As per the normal autoclave, that also color change from blue color. Why half of the kits are pink and half there are right today that they are buying the PP kit, but they're not aware whether it is sterile or not. The second question is you are having this kit. This is totally plastic, and how many of you know that sterilizing this goggle? So if it is a this is a very basic question. I don't think plastic can be properly sterilized in this packet. We already the packet can't get 130, 150. The plastic will be gone. You can't see a packet, beautiful packet like this. So you are being getting fooled by the name of sterile and non-sterile packets. Dealers, I don't blame dealers. I don't blame the delivery people who are delivering you because they are having very short knowledge with them right now. They are having very short knowledge about the about the PP or reacting the information. And you will be again shocked what I will be showing in the upcoming slides. So these packings, these packaging is no company name, nothing. That will be totally banned later on, and they will be used as a normal cloth, not a PP kit. So I just wanted to make you aware. No need to buy PP kits right now, whether they are from good company or bad company. That doesn't matter right now. We have to follow proper protocol. We have to receive the kit in a proper way. So in the next slide, we will be showing that thing. The recommended PP protocols, the packing would be like this, in which the manufacture date has to be mentioned, the expiry date has to be mentioned, that if it is properly sterilized, then it can be used by this time of expiry date. And the price has to be mentioned according also the lot number of the company, ISO certification, and the manufacturing license number. In these packets, I was not able to see anything because I want to tell you the reason. Because the glasses are being manufactured by some other company. The goggles are the face shield are manufactured by some other company. The dress is manufactured by some other company. So they are bringing all this stuff together and doing the packing after sterilization. So they don't have any certification, and which will result in the spreading the hazard uh, virus to everybody surrounding us. So this is the proper recommended packing. Also, it is mentioning that it is WHO certified. This only that person can write down in this PP packing who have all the certificates which have been required to manufacture a PPE kit and later on deliver this type of PPE kit. Even the GSM is mentioned and all the code words have been mentioned in this PPE kit. You can have the screenshot and keep it for your further notice. On this, I was the first one to receive this notice by some known person from my side. This was not written in the website of the Government of India. It was issued on 23rd of April 2020. The orange circle you have seen, this is regarding PP only. Why I showed the defective PP and all the packings and all the pink color PP? Because I want to show you this. It is already mentioned because of the lockdown, government is not able to take any action. Soon as all the lockdowns will be open up, everything will come out, then government will be, the state may take legal actions. I'm reading all the things which have been circled here. The state may take legal actions, including the imprisonment of the CEO if they have any COVID-19 positive employee in their factory. In such situation, the premises of the factory would be sealed for 6 months or so. And in case of non-compliance of precautionary measures, the factory will be closed down for 2 days, and may not be allowed to restart unless it will follow all the. What actually people are doing right now is they are I can say this is how the they are just applying for the citra certificate, and it usually takes a lot of time. The dealer are just applying for the citra certificate, and they are just how can approve it when it already applied for. So here the dentist or any doctor get confusion that it's a citrus approved PP kit, and they can be worn out, because right now a lot of companies have been waiting for getting their approval from Citra. Citra is not only the certificate which is required for manufacturing a PPE kit. I would like to mention, I want to take a minute. I want to mention something. There is a WHO GMP certificate. Apart from Citra certificate, there is a CE certificate of the fabric used, and all the related documentations are required. ISO certificates also required, and I will mention further all the necessary details which are required for manufacturing a PPE kit. Right now, I got an update that from 1st of April 2020, the government have ordered and notified all the dealers and all the manufacturers that they have to get registered themselves. Only those who are eligible to provide you the PP kits who are registered under the drug control. Nobody will be able to sell you the PP kit if they are not having the drug control license with them. It has been issued on 1st of April 2020, and this 23rd, the slide which has been running in your screen is 23rd April 2020, that the actions will be taken if any preventive measures have not been taken. So we had a breaking news that time in 17th of March that a first COVID case was found in UT, and it was registered here, and it was corona positive. The victim came from UK. Now comes what after the patient enters, and how before entering, and how the new patient who are entering our premises, how we have to disinfect our clinical area. So the common cleaners such as 0.1% sodium hypochlorite, 0.5% hydrogen peroxide, or even 62 to 71% ethanol have been shown to be effective pertaining to bathroom, waiting room, front desks, and operators. So the coronavirus COVID remains infectious from 2 hours to 9 days and persists better at 50% compared with 30% relative humidity. So I will be further mentioning, apart from these solutions, I will be further mentioning some brand names which are also giving the solution for disinfecting your dental chair, your suction units, and all the trays and instruments you are keeping on your table. This we have gone. So we have to sterilize all the light handles, switches, dental radiograph equipments, the dental chairside computers. For computers now, it is suggested that you have to make a transparent cabinet where you can keep your laptops because wearing a PPE kit or after that also you will be touching the keyboards and mouse to do the patient entries and everything. But I will suggest you to cover up your laptops with a transparent cabinet or anything else like this so that you don't get touch with your keyboard. Also apply a silicone rubber keyboard cover on it so that you can type on it and sanitize it and later on replace it with a new one within two or three typing procedures. So that is suggested because the silicone one is washable, so you can wash them and you can reuse them. Apart from that, the RVG unit, the RVG box are always exposed to the atmosphere, and it is suggested that all the wirings which are there in the clinic should be covered with the transparent cover or any cellophane like sheet so that no dust particle penetrate in that wire, and whenever you touch it, it won't give you any hazards. So it is suggested to keep your RVGs and other wires, remote wires or anything that should be covered properly too, and that can be changed in every next day. So the cellophane can be changed next day and everything can be changed and they can be sanitized also. To avoid pen and paper, avoid digital payments like card or cash from the patient, do the digital payment only like QR code scanning. So you should minimize taking cash and do the card doing the card payment. You should minimize these both. So your 5 moments for hand hygiene. These are your 5 moments for the hand hygiene before patient contacts, before aseptic task, after body fluid exposure risk, after the patient contact, after contact with the patient surrounding. So these 5 you have to maintain the moments. So these are all the details. You can find it in WHO website. So I don't need to go step by step. So it has been written when and why you have to use this procedure. Why you have to follow these 5 moments hand hygiene. So how long a corona lives on surface? You can take the screenshot. You can print out, take the printout and display in the waiting room. So the patient also get educated, and also you can place it in your clinical area so that your assistant can also get educated along with you. So you can be aware that which part on which part the corona lives for more longer period and how to sanitize that part and be protective from that thing, how to take care from that time. So we can just take the screenshot. Now you can see for 5 days the ceramic and the paper, the corona can last on their surfaces. So it is recommended to avoid getting the newspaper at your homes and clinics after the lockdown gets over. So please shut up with all the magazines and newspaper right now, because now we are in the digital era. We can read all the news from our phone. We have to sanitize our phone also. So now the question comes whether we have to keep our clinic well ventilated or a dry office. Right now, as per the information, it is suggested that you have to keep it as a dry office, but now the summers are coming, so we have to keep a pedestal fan in the waiting room as well as operatory room, so that the aerosol prevention is there and no virus spreading is there. So it should be, yes, obviously it should be well ventilated. If you are having a totally airtight room, so it is suggested that you should apply for a exhaust fan. So there should be a little bit of ventilation. So it is suggested that you should have a exhaust fan or the ventilation inside, in between the clinic and the waiting room and outside the waiting room, so that all the bad air which is inside, all the bad odor, that should be exhaust out. So also it is suggested, if you are not having patients or you are not doing any operatory work, you can, before making the patient enter to your clinic, you can use a little bit of AC just to cool down the temperature of your clinic, but it is avoided to make the use of the AC while doing any procedure. So you can make the temperature cool and later on switch off your AC just to have a good temperature at your clinic, and then we'll start with the pedestal fan. Now coming with the procedures that will be discussed, that how we have to do the dental procedures. I think maximum case right now what we can do is a normal consultation, and we can give a temporary filling to the patient if the patient is not any emergency case. In case of the emergency, we have to follow all the protocols, like rubber dam can be used to prevent the aerosols spitting out from the patient mouth and creating a nuisance in your clinic. So rubber dam can be used. It is a less effective method, but most of the aerosols can be prevented from, exposing in the surface. So that can be used if the patient is in swelling or anything. You can just keep the rubber dam sheet ahead, making a hole and doing the treatment accordingly. Now, what about impression? If we are doing some impression procedures in the clinics, so what protocols we have to follow now? I think impression sterilization have to be undergone, because the transfer of patient infection to the dental impression is a big concern for the dental labs and technician. There is a delay in the procedure because of the little bit slow. These are coming by the brand names of Procept Impression 360 and Procept Impression S, and also by the Septodont in the name of Diamondol. So both are available in the market, but I think in the future time, a lot of dentists will definitely require these two solutions. So it is suggested to all the IDA officials, all the staffs, state members, and all the local branches secretary members to please pass on the message to the IDA head office to tell the company to manufacture as much possible these types of solutions, because they will be required for the futuristic dentistry. And after the corona also get over, I would suggest to go for these solutions for the future practice also, because they are not that much costly. The diamond sol is costing around 500 to 650, and between 500 to 650, as well as the Procept Impression 360. This 360 is a total protection. This solution can be used to sterilize your impression and your impression trays, your instruments. Also, it can be used to clean all the debris which is inside your suction. So it can be used to sterilize your high suction and low power suction. The Procept impression S is the material that is only limited to the impressions and the trays. So they have a good advantage. The advantage is in the next slide. So the Procept S is costing around, for 1 liter it is costing around 1200 to 1300 rupees, and Procept Impression 360 it will be costing around. This is a solution you have to make, so it is around 3200 to 3500. I think it is out of stock right now, but soon the company will be coming with this in stock thing. It is around 35 to 3500. So it will be killing all the bacteria, all the fungus, and all the virucidals. So everything is mentioned. So the effective spectrum is 3% and exposure time is 1 minute. With all the viruses, it is around 1 to 3 minutes. All the viruses get inactive. So this is a very good solution which was suggested to me by someone. So I'm just waiting that the solution get in stock. So every dentist should have the use of this. I'm just recommending the Procept right now. If there is any alternative solution apart from this Procept and Diamond Sol, I will be happy to know about it. But Procept, the advantage of Procept is that you can use this same solution for cleaning and sterilizing your suctions also. So what is the benefit of Procept impression is that it will not alter the form or dimensional stability of the dental impression, whether taking in alginate or putty. So it has no effect on the form or stability of the dental impression. So it has a short exposure time. So all the disinfectant get active within 2 minutes and it shows its action. So it is economical to use. The solution once prepared with this bottle that can last up to 1 week. So you can use that solution for 1 week. And it is having a simple application because the 20 ml of little measuring jar is given there. So you can dilute it properly because the excessive quantity will give a false smelling. So we have to make a concentration in a proper ratio. So you can use this type of solution. Now we come to the most frequently asked questions in this corona. We are seeing a lot of things which dealers are doing, which the companies are doing, and we are waiting for the research thing and our answers. So the most important frequently asked questions are, what about the extraoral suction units? Right now in the market, every Chinese company and everyone are promoting these high power suction units or extraoral suction units. So they are suggesting that everyone should buy this extraoral suction unit. Right now, everybody is having the hole in the pocket. They are not able to afford these devices right now until and unless the IDA and these companies comes out with the easy payment facilities. If it is required to buy. Right now, I'm not suggesting anyone to buy anything. Just enjoy with your family, have a thorough knowledge, and get updated with your patient by doing them greeting SMSs and responding to teleconsultation and following all the screening measures which I have told you in these slides. So what about the extraoral section? Whether we should buy in future or not, whether it is effective or not, whether we should go for some beneficial mode of hygiene or something else can be done. Can we come with some alternate of this or not? So I came to some study because all are showing the demo of these extraoral suction. Some are showing that it can penetrate the aerosols about 90% and all. Some are taking the water bottle and doing, taking the weight of all the suction, just telling how much powerful is this suction, so it can suck all the aerosols. So we are coming with all the different videos. So a proper test with the extraoral suction was done because we were missing the literature, we were missing the results and whether it is effective or not. So I came with the literature. This test was done in a 65 years old patient, in which the subgingival scaling was done in the maxillary first incisors, second incisors, and canine, following with the mandibular second premolar, first molar, and second molar. So it was planned on a 65-year-old patient, and for testing the extraoral suction machine, the two types of machines were used. The particle counter to check the aerosols particles which are generating from the treatment and how much the extraoral suction unit is trying to take it from a machine. And we also are having the GSI Creos basic here. So this is just to see, count the bacteria colonies which are here in the aerosols and the mouth. So whether with the use of extraoral suction they get reduced or not, how much is the effective. So you can see below the pictures the intraoral suction alone, which has been done, which we are normally using. So the treatment was done from the right side. The scaler was used on the left side. Sorry, on the left side, the scaler was used. The subgingival scaling was done on buccal and the lingual surfaces of these particular teeth. And the right photograph is showing the intraoral suction along with the use of the extraoral suction. So the combination of both has been used, and the treatment was done on the right side. The distance between the mouth and the extraoral suction was around 5 centimeters, and which was angled at 45-degree respective to the ground level, to the floor level. So after the procedure was made to be done for at least 3 minutes. The 3 minutes, the continuously scaling and the intraoral and extraoral sections were used, and you can see the level of aerosols that the above two charts are about the level of aerosol, which was 0.5 microns and 0.7 microns before treatment, and intraoral suction alone and intraoral and extraoral suction combined. You can see the blue color, yellow color, and red color. The blue color one is the chart before treatment, and the yellow one is for intraoral suction alone, and the maroon one is for the intraoral and extraoral combination. So you can see the comparison chart. The upper two photographs are for the upper incisors, which were tested, the aerosol level were tested in 0.5 microns and 0.7 microns. And the lower two photographs are about the lower molars, which were the level of aerosol were tested were 0.5 microns and 0.7 microns. So you can see the graphical representation of these both the type of recordings we got. So this is the second machine which was used for counting the bacterial colonies. So the above one for the upper incisors. So you can see the regular colonies were 35, and with the use of the first photo was with the use of intraoral suction. The second one with the combined usage of extraoral suction. So you can see in the upper incisors how much difference is there between the without the use of extraoral suction and with the use of extraoral suction. So from 35 to direct 9 colonies are there, and the large colonies remain the same because they have the larger granular size. Similarly, for the lower molars, you can see the regular colonies with the use of intraoral suction were 25, which was later reduced to 8 with the use of the combination of both the intraoral and extraoral suction. And the larger colonies were also being healed. So definitely there is a good advantage of having the extraoral suction, but right now no need to book or buy because more quantities will be coming in the market and lesser will be the price of this device because it will become as a normal operated device which is to be used in the dentistry. So I request you to wait because its prices are starting from 49,000 INR to 75,000 INR. More companies, more brand names are coming with the higher price list because they have all the HEPA filters and all things. So it was about external section. Definitely, we have to wait for the actual results. We have to wait for getting the approval by the IDA. Whether after the lockdown, so we have to get it thoroughly tested and get more literature whether to buy it or not. So this was the report which I was getting. And now, what about the tooth or the mouth isolation? When we are doing any basic treatment also, so how we have to isolate it and the mouth or the teeth so that we get the lesser generation of the aerosol from the mouth and uh, it is betterment for our own and as well as patient for the treatment to be done. So it is suggested to go for the Optodam Plus. It is not a foolproof method, but up to certain extent, it will be helping to all the dentists to prevent the aerosol generations. Aerosols will be there, but there will be no saliva contact of the patient from the mouth, so that water won't be any harmful. And you can see the video how to apply the Optra dam. Now, initially, because this is the initially guideline I am telling you, this is not a permanent treatment, but these are all the materials which we are having available right now in the market, which can be used to further lessen the chances of spreading the COVID-19 in our dentistry. So, Optrodam Plus is suggested to you. You can apply in your practice. You can use in your normal dental procedures. The same slide is told what are the benefit of using it. The benefit is it is a broad range of applications. So directive adhesive restoration of teeth can be done in directive adhesive luting like crown or partial crown can be done because right now the government is suggesting to don't do any air rotor related work. You can use a micromotor and place the air rotor connector on it and use the burr and trim the thing. But I will also suggest to use the Optodram in that case also because if aerosols are also not generating, so all the micromotor, all the dust particle will be there. It is equally hazard for the dentist because we are trimming our teeth, we are doing anything, so dust will also be generated. So that time also this will be acting as a safe product for us. So endodontic treatment can be done in case of any emergency case, any swelling, any face swelling. That time also you can use this Optodam Plus. I know it is a bit costly, but that cost can be covered from the patient itself. So you can guide the patient what is the cost. So you can buy more products, buy more quantities for the upcoming patient. So it won't be any hectic for you in doing the treatment. The biggest concern which were arising was that we can't do any procedure now. How to take any X-ray because the X-ray will be risky for doing on the patient, and how to dispose of the X-ray sleeves. So by using this Optodam, if you are taking the X-ray, the chances of sanitization will be more, and your X-ray will be safe. You will be safe. Patient will be safe, and disposing your X-ray sleeve will be more easier for you. So if you are taking the X-rays, if you are doing any treatment on a patient, the Optodam right now is suitable. You can also do the rubber dam, but I don't suggest rubber dam right now because or depends upon the patient behavior. Some patients are adaptive to it and some are not. So it is very easy to go for the Optodam. So cosmetic and the prophylactic treatment procedures like office bleaching and fissure sealing, that can also be helpful with the use of this dam. What are the advantages? The advantages of going for this is it will be hardly costing 70 to 80 rupees for a doctor for placing this optogram in a patient mouth, which is not that much of costly if safety and health is your concern. So hard 80 rupees for saving somebody's life is not a bigger amount. So what are the advantages? It's an easy application thanks to the integrated frame and the pre-printed arch template. The only drawback right now here is that you have to have your own rubber dam punch to punch holes in it and place it in the patient mouth. You can use the flosser also to adjust the settings of the dam in the patient teeth. So high patient comfort thanks to the flexibility and the three-dimensional design, and simultaneously isolation of both the arches thanks to the tension-free placement. The second alternative is obviously the rubber dam isolation, but maximum patient will not be friendly with this because it will take time. Some patient don't get comfortable with it. So for them, alternative definitely the Optodam. The second question which was arising is the fumigator. What will be the role of fumigator in the COVID-19? Right now, there is no literature being provided or no research can be done right now because of the lockdown. So the data will be available as soon as the lockdown gets over. That fumigation plays any role in the prevention of any COVID-19. Right now, we don't have any details, so I can't be fully sure. But for disinfecting your clinic, this is a good option. A lot of doctors already have the fumigators. They are coming in a different price range and coming with the different solution compatibility. You can see the chart. It ranges from 48 to 170. And the prices get higher as much as the solution gets more effective. So I think the fumigators are costing a lakhs rupees and it is pricing from 8,000 to 1 lakhs. As per my information, I may be wrong also, but I came to know that we have a fumigator worth rupees 8,000 and it can range up to 1 to 1.5 lakhs. And all are available with these solutions. So it is a better, not for, I can't say it is better for COVID right now, but it is better to fumigate your clinic with these solutions so it can sanitize your clinic in a very good way. So it is also not suggested to buy. Right now, I'm not telling you to buy, but I'm just giving you the information that it is a good medium to to sterilize your clinic. If you have a patient, I request to have a gap of at least half an hour or 1 hour between each patient so that you get extra 15-20 minutes to fumigate your clinic until and unless the new patient walks in. So your whole clinic will be sterilized. You can wear your you can sterilize your dental chair with the Septodont Surface Sept also, that is suggested, or because it has isopropyl alcohol 70% with the 2.5% of chlorhexidine. So that can also be done, or different brand names are coming with the same composition. So if Surfa Sept seem to be expensive to you, so you can take the alternative solutions available in the market because they all are aldehyde free. So there won't be any discoloration to the surface or any object where you spray that sanitizer. So this was the last slide of my presentation, but before that, I just want to give you the reminders that all the dental clinics which are, because I am having clinics in my home also and in the commercial market also, I want to suggest that everyone who are having the clinics in the home, please maintain the social distancing. Please have the wash basin installed outside your house so that any patient who is turning in, they can do the hand wash there outside itself. and they can see the posters or standees, whichever you are providing them. So with the same technique, they can follow the all the protocols and do the chlorhexidine mouthwash. And as soon as the patient walk in, the self-assessment form has to be filled, the consent form has to be filled. It is better you vocally explain to the patient. If he's not able to understand English, you can have the Hindi format of this also. Uh, and on the home clinics, what you have, the changes you have to make is, if you are having any curtains in your clinic, you have to remove. I will suggest remove the curtains from your clinics right now, because the more dust particles are there, and it is not suggested that whether it's a commercial clinic or a home-based clinic, no curtains are allowed to be in your clinic, because as soon as you are doing the aerosol generated procedure or even the micromotor based procedure, all the dust will absorb in the curtain, which will be a sort of threat to the assistant and you and the upcoming patient, whoever walks in and walks out. Thirdly, no things that should be placed in the waiting room. No TV remotes, no coffee, no glasses, no fidget dispensers, no switches to be touched. You can label on the switches that nothing has to be touched by patient. If you want to have a fan speed to be fast, he should tell to the assistant to do that. So no touching should be there, and patient should wear a mask. And I forgot to mention one more thing. I will suggest all the local branches and the state branches of all the IDAs, from whether from my city or any other city, to please talk to the dealers and provide some type of medical emergency kits to the chemist, because the consumable items which are like interdental brush or flossings, everything will be available with the chemist at no price rise, because they won't be doing playing any major role in the COVID-19. So I think my expectations are that they will be offered in the same price category as it was used to. But I suggest to the all the authorities to please pass on the message to the ID head office, to and also to your local state branches, all your members, to please provide, talking to the dealer, to please provide the medical emergency kit for patients, few quantities from in each gamete, like 5 to 10 quantities in each gamete. So the same should be notified to the all the IDA members of the respective local or state branch. So they should be notified on their WhatsApp group or anywhere that we have provided the medical emergency kits for the patients, like a temporary filling or a plastic instrument. So interdental brush is already there, mouth rinses are also there, artificial saliva solution is also there. A lot of things are there. The chemists are already having everything, but a temporary filling and a plastic instrument, a little pouch type emergency kit is required, where a patient can buy this. So in this lockdown period, if it further get extended, because we can't commit whether the lockdown will get free on 3rd May or not. So the 5 to 10 quantities each should be provided to every chemist. If they are getting used, that would be a good sign. If they are not getting used, the same will be taken back from the chemist, so that he also won't suffer any money issue, or that stock is not getting booked or something. So the same will be taken back to the dealer, so that can be further used by the dentist. As per the emergencies, the patient which are having orthodontic treatment, sometimes their wires are removed, so now dentist can't touch it. So better every dentist guides a type of patient to use the scissor or a nail cutter to cut that sharp wire, which is already been disturbing you and creating the ulcers in the gum. If there is any denture patient calling you, if it is having a ill fitting or a loose fitting denture, you can ask them to have a Denofit or any denture adhesive cream which is available in your state or city. Danofit or 50 Dent or any brand, you can tell them, or to tell them to remove that thing. You will obviously require a denture cleaning paste, because it won't remove, the material won't remove, the 50 Dent particularly won't remove until and unless we use the denture cleaning paste and brushes. If a denture patient is having sharp points, if he's complaining of any uneasiness while eating, so you can suggest a little bit of sandpaper, so a patient can blunt that sharp point, so that these are only emergency. I'm not here to degrade my practice, but this is the only thing we can do right now. A little bit of rounding off of the denture can be done, so that patient would be easy to eat. So later on that can be polished, or anything can be done from the lab itself. And if the patient is having I forgot that the temporary filling. If a patient is having cavity, so there can be chances that there will be a food lodgement there. So the more food lodgement is here there, the more the cavity will be, and further will require a root canal treatment. So that's why I was suggesting to please provide 5 to 10 quantities of the medical emergency kit. If you think any further more items can be added in that kit, I would be more than happier. So 5 to 10 quantities should be provided, and further they can be returned to the dealer if not used, if not purchased by anyone. So that's all from my side, and thank you very much.